Tom, you're looking great now. You're looking very great and smart now.
Thank you.
No.
You know, I took my jacket off thinking Tom was not wearing a jacket today. And then yeah, he goes and gets one on. Wonderful, Doc. Okay, we have about 50 people who have already joined in. So in the interest of time, I think we should get started. Good evening, everyone. A very warm and hearty welcome on this lovely monsoon evening in the city of New Delhi. Right, a lot of traffic and snarls outside, but I guess a lot of peace inside. We're very pleased to have with us today Dr. Tom O'Brien, Dr. Subhash Vangnu, Mrs. Shikhosla, Dr. Arjun Dang, and Ms. Anuradha Kar. We'll be having the topic of today's panel discussion is wheat-related disorders and diabetes. There's a very strong linkage, in fact, which needs to be explored and awareness needs to be created on how this linkage exists and the kind of effect it perpetuates. I'm your host, Arjun Mahajan from Jay Mitra, and I will take 2 minutes to introduce the panelists to each one of you. We start with Dr. Tom O'Brien, right? Dr. Bryan is an established medical practitioner and the Chief Health Officer at NoviWell. He is no stranger to talking about wheat-related disorders, and we look forward to his inputs today. Our second panelist is Dr. Subhash Kumar Vangnu, a senior consultant endocrinologist, president of the Indo Society of India of Delhi, and the founder and the past president of the Delhi Diabetic Forum. He's currently working with the Apollo Center for Obesity, Diabetes, and Endocrinology. Our third speaker for today, Ms. Shikhosla, actually needs no introduction, right? She is someone who needs no introduction, especially when it comes to health, clinical nutrition, writing about food. She's an author, an entrepreneur, and researcher, and actively involved in the clinical practice at the Center for Dietary Consulting in Delhi. She's also the founder member of the Celiac Society of India. Our last but not least is our moderator, Dr. Arjun Dang. Dr. Dang is an CEO of the Dr. Dang's lab in Delhi, right? And one of the most highly acclaimed quality conscious labs within the Delhi NCR. And he was awarded the Hindustan Times Trailblazer Awards in 2021 during the COVID pandemic for setting up India's first ever COVID testing drive-through in April 2020. Welcome on board. And the one person I will not introduce today is Ms. Anuradha Kar, but our speakers will do that for themselves when they take us through the panel discussion, right? Dr. Dang, all over to you, all yours.
Thank you so much for the kind introduction. And a very good morning to our viewers in the US, a very good afternoon to our viewers in the UK, and a very good evening to our Indian viewers here as well. And all of us have been super excited for today. And this 1 hour long session that we are going to have now is going to be full of facts and full of learnings, not only for people from the medical fraternity, but also otherwise viewers joining us who want to learn more about this topic. And as we've already been introduced, and we know that we have stalwarts in the subject and subject matter experts in this particular subject. Without wasting any more time, I'm going to directly jump into the topic for today. And the topic for today is the linkage between diabetes and your gut health. And as we all know, that diabetes has been a pandemic that has been there since many decades. And through COVID and post the pandemic also, we've seen that the number of diabetics that we are getting, not only owing to the rampant use of steroids, but also due to the sedentary lifestyle. Now, work from home has become actually a working style that a majority of companies I see, even post the pandemic now, are not shifting their employees back to office. So the kind of trend that we are seeing right now is that there will be 134 million diabetics by 2045. That's what a research had quoted. And those are just mind-boggling figures. And I think the first step of actually curing a disease is to understand it, to make people aware about it, and hence us meeting today to discuss more about it. And as Arjun has already told us, we have Dr. Tom O'Brien, we have Dr. Subhash Kumar Wangnu, and also Miss Ishi Khosla. And without much further ado, I will jump to my first question to Dr. Tom. And I would like to say that there's been a lot of talk about how gut and diabetes are very closely related. And I would like to start off today's discussion with your ideas on this broad connection between your gut and diabetes.
Thank you. And thank you to the panel for the invitation to be here today. It's an honor. If there is only one effort we're going to make to be healthy, if there's only one that we can do, the most significant one is to have a healthy gut. The diverse background in the gut called the microbiota, the good guys, the good bacteria and the good viruses that we have in our gut, they are in control of so much function. For example, for every one message from the brain going down telling the gut what to do, there are 9 messages from the gut going up telling the brain what to do. The gut has its hands on the steering wheel of how our body runs. And when your gut is out of balance just a little bit, turn your steering wheel just a little bit and not too far off, you're off the road. And that's what happens in our gut. We want a healthy gut for all aspects of life. I'll pause there with that.
Great. So, Dr. Tom, that's very nice to know, and I love the way that you describe these very scientific kind of pathogenesis and very deep meanings in your simple way, the way you describe it. So I'm going to take home with me the steering wheel and the gut example that you've just given. Dr. Magnu, any thoughts from your side to set the tone to today's discussion? Anything about your gut health and diabetes, and over your years of work, sir, anything that you would like to introduce this topic by and help us learn more?
Thank you very much. And I think for an endocrinologist, gut microbiota and the pathogenesis both of type 1 as well as type 2 diabetes has been established beyond doubt. As Dr. Tom told you, there's a strong linkage between the gut microbiota and the type 1 and type 2 diabetes. There are a lot of publications from the Indian subcontinent. What kind of microbiota are good for the health? What kind of microbiota are the bad? How that transition takes place from the birth, neonate, to adolescence to the adult, how the microbiota starts changing, and how this microbiota changes its structure and the kind of microbiota, how it leads to the development of diabetes, whether it is type 2 or type 1. And a lot of pathogenetic mechanism, hypothetical explanation have been put forward for this pathogenesis of type 2 diabetes as well as type 1. Having said that, Tom has already said the ball rolling that there's a strong connection between the gut and the overall body health. And we know the gut is the biggest endocrine organ of the body. Our insulin secretion is really governed with the hypothalamic pituitary enteroinsular axis. The concept of the hypothalamic enteroinsular axis, it carries the impulses through the gut only. And that is the important part of regulating your appetite, the satiety, the release of the, the GIP or GLP hormone, glucagon-like peptide hormones. So this is very strongly. And diabetes being an autoimmune disorders and the other weight-related disorders, also autoimmune disorders, we'll be discussing later on what is the strong link. But to an endocrinologist, gut is an important, the biggest endocrine organ which regulate your overall body's health.
Thank you, sir. So your gut is indeed the largest endocrine organ, and that is a great point. So, Ms. Ishi, coming to you, and from the years of experience and dealing with patients who are struggling to have a good diet and to contain various kind of chronic diseases, and diabetes being one of the most common, I'm sure you have really interesting and real life stories to educate us. a little bit about this and the bridge between good gut health and controlling diabetes?
Yes, Arjun, the journey of learning for me personally has been really very, very interesting. And I would say, coming from a nutritional background of nutrition science, I practiced what we learned in our through our textbooks. And up until, I would say, 10 years ago, those tools helped us manage blood sugars. The tools helped us manage things like obesity, extra weight, belly fat, and the numbers like cholesterol, etc. But when we started understanding the connection between the gut, the microbiome, inflammation, and chronic inflammatory diseases like diabetes, type 1, type 2, it was a paradigm shift. It was so rewarding. It was like those aha moments, that, oh my God, this happened. And then you study more and get into the depths of things, and you put it in clinical practice. And without exaggeration, I began to have a problem in terms of managing the physician and the patient, because the rapidity of change in blood sugar levels, the rapidity in change in general overall well-being, by addressing gut health, by addressing nutrition, by addressing overall, the calories and macronutrients, and the other lifestyle issues, not to miss those, the holistic approach. When we started working on that, I was having a problem with the medication and the managing the insulin levels, because the patient would nosedive. The sugars were just getting into hypoglycemic states. And so, in fact, the case study we will be having will showcase that issue. And therefore, that was a challenge for me. And we have been through struggles and these kind of challenges, but certainly addressing the gut and the root cause of the disease has been an absolutely big game changer for me. And, I would not hesitate to say that early diabetes can also be reversed.
Great, that's very insightful and interesting. Thank you for that. And speaking about case studies, we have Anuradha ji with us, and it's been close to a decade that she's been taking Ishi Khosla's advice on what to eat and all the nutritional science that one needs. And Anuradha ji, a very warm welcome to today's show and today's talk. And looking forward to understanding from you what was the main reason, or what were the different issues that you were tackling probably before you consulted with Ishi Khosla, and then what are the changes that you've seen? And also, a lot of times, and also when I meet my non-medical friends, they tell me that if you're explaining something to me, we don't want to hear it from you. We want to hear it from someone who won't use any scientific terminologies. So I'll give over the mic to you, and we just want your thoughts on what really metamorphosized with the different changes that you did to change and to metamorphosize your gut health.
Oh, actually, in 1993, I got ITP, and from there it was just a downhill kind of a thing. And then in 2003, I got diabetes, and I was being treated for diabetes. Medicines were being supplemented by medicines, and then I went on to insulin, and I went on to about 100 units of insulin. And it was just my whole body and my mental state was just going haywire. And then I also got kidney. I got CKD, and it was like 3rd grade CKD. And I was scared. Our next stage is dialysis and things like that. And I had been to Ishi some time back, and I had really controlled it. And we as Indians or whatever, I can say, oh, we can do this ourselves, but it's not possible. We need the help and the guidance of somebody who can take us and walk us through this. And need to be answerable to somebody, and it's our doctors and our nutritionists, and everything goes hand in hand. It's not just that I can have my medicines and my diet is not being taken care of, and in the bargain, I got a fatty liver, I got arthritis, and everything was happening. And I had gone up to, my weight was about 120 kilos when I went back to Ishi about 10 years back. And I said, you need to save me. So, and it was a tough climb, and but I said, no, I'm going to do it. And I've done it. From 120 kilos, I've come down to 91 kgs. My creatinine is 0.9 as of today. My diabetes is under control. I'm not on insulin for the past 7 years now. And my diabetic medicine is also reduced to about 500 milligram in the morning and 5 in the evening. Yes, my diet is very controlled. I'm totally off wheat and milk products. So my protein intake is bare minimum, and wheat I haven't had. So no cakes, no pastries. And yes, I exercise, and I also got arthritis, as I mentioned. I also have thyroid. So everything, my parameters are more or less under control as of today. I don't have a fatty liver at all now. I am like a normal human being. So yes, there are few days, there are ups and downs, but I think I will walk through life in a healthier way.
No, I think Anuradha, that is an extremely inspiring story for a lot of us, and the number of chronic conditions that you enumerated, starting from ITP that you started with, and then CKD and so many others. I think hats off, and obviously with Ishi's guidance, and you managed to actually reach that destination. But if I may say, it's not a destination; it's a journey. And I think every day is an uphill climb, but it gets simpler. So very, very enlightening and very helpful. And thank you for your insights. So Dr. Tom, coming to you, and I was actually sometime back reading your book as well, The Autoimmune Fix, and I was reading about the rainbow diet and how it can either be keto inspired or paleo diet inspired. And could you tell us a little bit more about that? And for diabetics who are on treatment, who are trying to monitor their HbA1c, and also trying to improve, what is the best kind of diet, and how do you actually take care of your gut health to actually monitor and get the best out of the diabetes management?
Well, thank you. Yes, of course. What is the best diet? Well, what is the best color coat to wear? If we look at our experts here, Ms. Ishi is in white. You, Dr. Dang, are in white. I'm in blue. Dr. Wangu is on a blue shirt. So what's the best? There is no best diet. That it depends on the individual, but there are some basic concepts that are critically important. The first concept is that carbohydrates, there are 3 categories of foods: proteins, carbohydrates, and fats. Carbohydrates are not essential in the human diet the way that we eat them today. Carbohydrates are sugar. And when you eat too much sugar, more than what your body can handle, the result is the sugar gets converted to fat. And that mechanism occurs in the liver. And eventually what you get is fatty liver, which is what Ms. Carr had back in the 1990s. And that sets the stage for so many problems down the road. But there are some basic concepts in choosing how to eat. And Ms. Kolsa is the expert on that, of course. But the colors of the rainbow, the colors in vegetables and some fruits, but mostly vegetables, should be the predominant portion on your plate at every meal. The colors are different categories of ingredients called polyphenols. And these polyphenols have so much benefit in our body, many, many benefits. A primary one is that they feed the good bacteria in the gut. And the more you choose and in medicine, we call that a diverse microbiome, that you have a lot of the different types of good guys in your gut, and you've got a lot of them. And they protect the gut from the bad guys that are in the food that we eat. We all eat food sometimes that has been in storage too long, may have a little bit of bacteria on it, or that's not really too good for us. But if we have more of the good guys in our gut to protect us, we're fine. We're fine. So the colors of the rainbow, as many colors as you can at every meal, is a very good starting point in choosing what goes on your plate. And I will stop there.
Thank you, Dr. Tom, for that. So, Dr. Wangno, coming to you and coming back to the largest endocrine organ, that is the gut. And any insights from you on how to take care of this largest organ in order to control our blood sugar levels and control our HbA1c?
Well, Tom has given emphasis on the particular diet, not a particular diet, but the kind of food we have to eat in managing a diabetes. What we have been taught, what we have learned as an endocrinologist about the underlying different pathogenetic mechanism of type 2 diabetes, which is multifactorial. Type 1 diabetes is pure autoimmune. Commonly, we see type 2 diabetics and the old mantra means the basic diet for the diabetes, what we tell them, should be small, frequent meals with high fiber, complex carbohydrate with protein and fat. Zero carb diet we usually avoid in diabetics. We had to have some portion of the carb in the diet along with the protein and the fat around 20-25%, 20%. But zero carb diet, I usually don't prescribe to my diabetics because the energy, all the even proteins you are taking, the fats you are taking, they're going to convert into the sugars in the circulation. What are the carbs you are taking to the circulation? It is the type of the food, whether you're taking simple carbs or the complex carb, how quickly it gets absorbed, and there's a insulin rise and there's a glucose excretion, whether it goes down within a stipulated time or not. So a balanced, small, frequent, without any direct sugar, high fiber diet is the basic diet what we prescribe to all our patients. And that is important because if we see two major trials, the diabetes prevention program in US and the Indian diabetes prevention program in India, we're basically focusing on the diet and the use of these some pharmacological agents like metformin in the prevention of diet. You'll be surprised to know that pre-diabetic stage were prevented into converting into type 2 diabetes by simply doing dietary modification and the exercise, leading to this more than 70% people, they prevent themselves from going into the type 2 diet. This is the importance of the diet. And we should tell the patient about the diet. And coming to the wheat-related implication, Tom gave us some good idea about the gluten. I agree with that 100%. And it has been our experience also that removing gluten from the diet do help in improving the insulin sensitivity and controlling the diet. But it has to be seen which kind of the population is genetically predisposed to this gluten hypersensitivity, because all patients cannot be gluten hypersensitive. All population throughout the world can't be gluten hypersensitive. So this is basically my opinion.
Dr. Dang, if I may be clear, I would not endorse a no carbohydrate diet. And I did not mean to suggest that.
Yes.
However, for most of us, somewhere between 70 to 80% of the food we eat is carbohydrates. And so the excessive amount of carbohydrates gets converted to fats and you get a fatty liver, and then the whole downstream effects that occur over the years from that. Dr. Wagner is absolutely correct. I agree with him 100% that 20–25% of the diet being complex carbohydrates is a great idea. And that gets confusing for people. So the easy way to remember it is the majority of your plate is vegetables, a little bit of quality meats, and then a little bit of carbohydrates on the side, which may be rice or quinoa or amaranth or some of the Indian grains that Ms. Ishi will talk about.
Thank you.
Great. No, thank you, Dr. Tom, and thank you, Vagnu sir. Actually, it's a great take home for everyone watching that about 20–25% should be complex carbs, and I think it is that balanced kind of nutrition that we are trying to empower the good guys in our gut with. So Mrs. Ishi, so I would like to ask you that we are talking so much about the gut microbiome and talking about how to balance this diet in order to control our blood sugar levels. And overall, in a nutshell, what would you say that how do we strengthen our gut? And especially for diabetics, what are the key concepts or the key points or the takeaways that you would advise us?
Thank you, Arjun, for that very important question, because as practitioners of science, we talk scientific jargon, which confuses people and makes our advice redundant, and sometimes not even it's not even followed, because no matter how much I give you, even for me, if I'm to do a 2/3, 1/3, 70%, 80%, or even if you look at label, I will not decode it and put it into practice. I eat food. So one of the biggest takeaways from today should be that we talk in real time food. And food is really broken down into food groups. But before I go there, if there is one word, because I don't like to, call a label a diet and limit it, calling it a keto or calling it a gluten-free or calling it a low-cal or a low-fat, all of these get very limited and very skewed by the end of it. Very, very imbalanced. So all the word, if I have to give it a word, it will be an anti-inflammatory diet. And that is where the whole, concept of whatever has been spoken fits in, that you have more polyphenols, you control your carbohydrates, you have less insulin, which is also pro-inflammatory. So overall, the inflammatory quotient of all the food that you eat should be very, very low. And thereby, it means that you avoid foods which trigger inflammation for the gut. And in a simple way, I would just put it, since we are talking gut, microbiome, obviously, what is not good for your gut, what is not good for your microbiome is not good for you. And they like food which is friendly, free of toxins and free of chemicals. And they love fiber, that's their food. Polyphenols is their food. Good fats are their food. Even, we've abandoned, just for example, abandoned butter and ghee from the Indian homes. It was a sad development which happened somewhere in the 80s and 90s, and everyone was using highly polyunsaturated pro-inflammatory fats in place of food for the gut cells. Butyric acid is food for the gut lining, for the mucosal membrane. And butyric acid, the biggest source in our food is butter and ghee. So just to give you a simple, example of how we have to use the right kind of anti-inflammatory foods to build up our gut microbiome, to build up the gut strong, the mucosal membrane to be strong, and prevent or control the leaky gut. I'm still not answering your question in full, because I've got a little qualification to do regarding the wheat issue. And here, I would say that in my practice today, one of the biggest triggers for what we call a leaky gut and a disturbed microbiome leading to inflammation has been found to be wheat, because of its connection with, these are very new concepts, zonulin. The zonulin, there are other aspects as well, but this is one of the most important. And zonulin is secreted in the gut by wheat protein, which is gliadin. And that is highly, highly pro-inflammatory. So who is a candidate for wheat reduction or wheat elimination needs to be established by the fact that if you have an established diabetic condition, that means you have inflammation. That's the origin, and you have a disturbed gut. So I would use wheat as one of the most pro-inflammatory foods and very easy to substitute in the grain scenario which we have in the environment, in the ecosystem of, at least in India and across the world. I think it's not that difficult. But we have a variety of grains. We have millets and we have pseudo cereals, etc., which can be substituted, which in clinical practice actually work. And we have the advantage of low glycemic pulses, which if you mix with the grains, you lower the glycemic load and the glycemic index, and we get fabulous results. So that is a question which really needs, customized advice, of course, and an important, I would say, takeaway for the audience. When we come to diet, it's not about just what you eat. It's about how much you eat. It's about when you eat and how you eat. And all of these today have a scientific basis. I mean, how much to eat is, we all need our, this has been discussed. The best way to represent how much food you need is through the plate. Just have half your plate full of vegetables and divide the others with protein and grains. And since I haven't specified the food groups, simply put, we have vegetables and fruits as one food group, and then we have the proteins, then we have the fats, and then we have the meats and the proteins and the dairy. Dairy also has been found to be a trigger food for some people who have disturbed insulin levels, and that science is also clearly established and backed up by our clinical experience. For instance, if Anuradha ate curd or she ate an ice cream, not forget the ice cream because that has sugar. If she ate paneer or something, 2 days later, her blood sugars were elevated and remained elevated for 2-3 days without any other factor interfering. So we know this for a fact that there is something which is triggering inflammation with milk protein. So both these are important tools which can be used by a clinician to manage the food, but that's oversimplification of the diet. So yeah. So yeah, I think that's the timing is important, portions are important, and how you eat also, and how you live the lifestyle. It has to be an anti-inflammatory lifestyle. Over to you, Tom.
That was a wonderful summary, and there is so much to learn. You're not going to learn it in an hour. But one of the takeaways I want to emphasize what Ishi just said about butyric acid or butyrate. It heals not only the leaky gut, it heals the leaky brain. Any membrane that leaks, which is your gut, we've all heard of leaky gut, the brain, any person that has brain concerns, whether it's depression or anxiety or schizophrenia or Parkinson's or Alzheimer's, they have a leaky brain, allowing inflammation to get into the brain. Butyric acid is one of the most important things, most effective things you can do to help to heal those barriers and thus reduce the need of your immune system to create this inflammation. And Ishi gave a great example. My wife and I put ghee in our coffee every morning. And I use a little blender, handheld blender, and I just blend it. And it mixes very easily. So we get the good fats to start the day with our coffee. There's so many little pearls that you can learn over time. You don't learn it in a day. But today, one of our goals is that we understand this concept, this big picture, that what I put in here is going to affect whether or not I get diabetes and how do I calm down the diabetes. So the most important thing to consider is what's on the end of your fork. Other things are important, like exercise and having quiet moments. There's many, many contributing factors, as Dr. Wangu has already referenced. But for today's discussion, our emphasis is on wheat and on blood sugar and how food affects it. And the only comment there's two comments I'd like to make about wheat. And that is, at Harvard Medical School, what they're teaching now is that all disease begins in the gut. All disease. 14 of the 15 top causes of death in the industrialized world today are chronic inflammatory disease. It's inflammation. So if we focus, as Ishi said, on lowering the inflammation in our body, it goes a long way to calming down the top 14 causes of death in the world today. And how do you lower that inflammation? There are many things you have to do, but the most common source of inflammation is what's on the end of your fork. That's most important to understand. And you're not going to change your eating in a day or a week. But if you understand this concept, on a plate of food, half the plate of food is vegetables. That by itself is going to change your metabolism. Just focusing on that. And there's much more to include, but critically, and then what vegetables? The rainbow diet, as many colors as you can find to mix of the vegetables that you're eating. That by itself will change your metabolism in just a couple of weeks. We've seen YouTube videos now for many years. Just go to YouTube and dial in diabetes and vegetarians. And when people focus on eating a lot of vegetables, they begin to stabilize their diabetes. We've known this for many, many years. So the concept of a rainbow diet is critically important to take away today.
Thank you, Dr. Tom. And that was really nice. I've been taking down notes as well. And coming to you, Dr. Manu, sir, I'm sorry I couldn't come to you earlier. But in your clinical practice and over all these years, you've seen so many, maybe thousands of patients. And when they come to you, and obviously you do advise them how to monitor their diet, how to take care of their gut health, their medication management, lifestyle advice. But what are the key criteria that how you monitor their dietary success, or if they are being able to monitor their diabetic status? And the medication that you are giving, is that really helping? You need to change it, because usually, sir, a lot of people come and they get an HbA1c done. I've been reading a lot of studies and looking forward to getting your insights on this. That is that the right test, and usually like a broad kind of a thumb rule or something that you can tell us more about.
Thank you, Arjun. I think everybody has said very good things, and we know the diabetes has been dubbed as a pro-inflammatory state. When we teach our students, diabetes has been dubbed as a pro-inflammatory state, and the inflammation, which is basically a cause of the endothelial dysfunction, is triggered by the hyperglycemic insult. And this hyperglycemic insult, the basic problem is the underlying insulin resistance. That is number one. Diet is very important and forms an integral part of management to all the patients, whether a type 1 and type 2 diabetic patient. Now coming to the what kind of a diet and whether the wheat-related diet has a very strong connection between the diabetes. See, the literature is flooded with the connection between the type 1 diabetes and the celiac disease, the wheat-related. And there's so many publication literature about the different incidence and prevalence of the celiac disease and type 1 diabetes. And that is why when we see a patient type 1 diabetes, we always screen them for the presence of antibodies to the tissue transglomerulase TTG antibody, IgA group. In type 2 diabetes, so far, there have been very few studies to find a strong link between the gluten and the development of type 2 diabetes. And type 1 is totally understood. It's a strong connection. I will show you some slides, what kind of a connection between the diabetes and the celiac disease, because this is important for the Yeah, this is basically the newer insights into the pathogenetic overlap of the type 1 diabetes and the celiac disease. Genetics plays an important role. I am sure about it, everybody knows about it, that there are certain genetic variants which are very common with the celiac disease and the type 1 diabetes alone. They are both HLA and the non-HLA variants, which has been proved beyond doubt, which is places the genetic predispositions for the development of both type 1 diabetes and the celiac disease. Apart from the genetic disease, then the environmental insult, which trigger the immune mechanism in a genetically predisposed individual, whether it is any kind of infection, whether it is the gut microbiome or the infant feeding formula. And Dr. Tom has basically been discussed about the infant feeding, and we give a lot of gluten in the initial stages of the development of the child. There are a lot of chances of development of type 1 diabetes in the later part of the life. The environmental insult in the form of the gut microbiome, infections of, it may be any viral infection, anything, and the infant feeding formula. Then third important common link is between the celiac disease is the abnormal, adaptive, and the innate immunity, both in the type 1 diabetes and the celiac disease. So this genetics, environment, and the immune dysregulation, these three important factors, they cause a connection between the both celiac diseases and the type 1 diabetes. Unfortunately, not many studies has been known to see in type 2 diabetes, because in type 2 diabetes, there are not much studies. The screening for celiac disease in poorly controlled type 2 diabetes, whether it is worth or not, she will tell me that I would like to screen all type 2 diabetes for the presence of celiac disease, and even the patient is not having gluten hypersensitivity, they should respond to the gluten-free diet, causing decrease in the inflammatory process. Immune factors might have a role in the pathophysiology of the insulin-resistant type 2 diabetes, but there is very scarce data about the prevalence of celiac disease in type 2 diabetes. Prevalence of celiac disease, poorly controlled type 2 diabetes, despite insulin therapy, again I am focusing here, is slightly higher than the actual celiac disease. That is why Anuradha, who was having diabetes with high dose of insulin, and she responded very well with the anti-inflammatory diet, because these patients are more prone to get the celiac disease in connection with the poorly controlled diet despite the highest dose of the insulin. And insulin treatment per se, with the patient high dose, should be additionally tested for the celiac disease, especially when they have very low C-peptide. So this was basically my take-home message for all of you, that we do come across, we screen all the type 1 diabetic patient for the thyroid disorder, for the celiac disease, and we do advise them. And many patients, if she will, I think, agree with me, and many patients who have type 1 diabetes with the celiac disease who really present with the growth retardation, pubertal delayment, and they do wonderful with the dietary advice from the nutritionist.
Thank you, sir. That is indeed very interesting, and especially your slide about how the three factors really affect celiac and diabetes and the entire connection, genetics, environment, and the autoimmune processes. I think that's very interesting. Thank you for that, sir. So Dr. Tom, one thing before we run out of time, and usually whenever I speak to you, I always run out of time. So today is yet another day, but I'm going to pick a very important question. And so a lot of people now are also speaking about NCGS and non-celiac gluten sensitivity. And I've read some articles, but it's very difficult actually to put it in a nutshell the way that you are going to do it for all of us. A little bit, if you can just tell us, because in med school and in all conferences and other papers, they've explained celiac disease really well. But I would really like the audience today to learn from you in a couple of minutes, broadly what NCGS is and whatever you can teach us about it.
Okay, thank you. NCGS means non-celiac gluten sensitivity. And we have to understand that in medicine, we all cut our teeth, meaning where we learned about the dangers of wheat, which was with celiac disease. And so we all were trained, when you think about a problem of wheat, you look for celiac disease. And if they don't have celiac disease, they don't have a problem with wheat. We now know that's not true. And it's kindly referred to as a historical misconception in the medical literature, that celiac disease is critically important to identify. And there's a very strong correlation of, if you have the genes for celiac disease, it's the same genes that make you vulnerable to type 1 diabetes. So there is that very strong connection between type 1 diabetes and celiac disease. But there's a world outside of celiac disease that our medical textbooks didn't talk about. They're teaching it now at Harvard and other medical schools aggressively. They say that leaky gut, for example, is the gateway in the development of autoimmune diseases, meaning the chronic inflammatory diseases. You have to have leaky gut. And what they teach, the two most important triggers for leaky gut are the exhaust of bad bacteria in your gut, that's called LPS, and gluten. Gluten and LPS are the two most powerful triggers that cause leaky gut. When you have leaky gut, now you get the systemic inflammation. And if you pull at a chain, wherever the chain breaks, at one end, the middle, the other end, your heart, your brain, your liver, your kidneys, your thyroid, wherever your genetic vulnerability is, you pull at the chain too hard, and inflammation is the pull on the chain. You pull at the chain too hard, and that's where you're going to develop a problem, not just celiac disease. And gluten and LPS are the strongest identified triggers pulling on the chain, causing inflammation. One more point. 2 slices of whole wheat bread, make a sandwich. 2 slices of whole wheat bread creates more of a demand for insulin than a candy bar. It's called the glycemic index. And the glycemic index for whole wheat bread is higher than a Snickers candy bar, which means the more gluten we take in, the more demand for insulin we have. And at some point you cross the threshold, and now you have the whole inflammatory complex pulling at the chain. Now your thyroid's not working so well, or now your joints are not working so, or your skin or your brain. The most common system is the brain, but it could be wherever your weak link is. That's where when you cross the threshold of tolerance for how much gluten you can have, when you cross that threshold, it can be at 2 years old, 20 years old, 92 years old. Whenever you cross that threshold, now you're throwing gasoline on the fire every time you eat wheat.
Dr. Tom, I want to ask you one question. With your statement, I think one of the most important pathogenetic mechanism of development of diabetes, which we also call the pro-inflammatory state, is the leaking gut and the LPS and the gluten. If this would have been the important factor in triggering the inflammation and causing the type 2 diabetes, wouldn't we eradicate the diabetes from the whole world by giving the proper dietary advice?
That is a wonderful question. I don't think we would eradicate, but we would greatly reduce. If I ask Ms. Ishii, ballpark, what percentage of your patients, when you put them on a gluten-free diet, their blood sugar stabilizes? What percent?
100%.
100%. So what that means—
when they follow the diet, it's so, like I said earlier, the word oversimplification. So it doesn't mean that I start giving you mounds of rice or starchy food or unhealthy food. So within carbohydrate exchanged and controlled, and I have done that within, because I understand portions. So there was one patient who came very, very lean, had no other risk factors, but her fasting sugars were always over 100 and she was baffled. I said, instead of that one roti that you have the equal amount of carbohydrate through rice. And that is about half a cup, one small chapat. And she had been battling this for 5-6 years. And she came back to me in 10 days with a fasting sugar of below 100. It was 95. And she came and hugged me and she said, I've never seen that reading. Just isocaloric, same amount of carbohydrate, but the nature of carbohydrate was different. Absolutely. Yes. And no other, we didn't change anything. So I have done this in clinical practice on several patients. But today when I treat the patient, this is for science, for people who have a scientific mind to control the variables. But when I treat a patient, we have so many other, we look at the nutrition, we look at micronutrients, the proteins and the other aspects. So it's, I will not make that comment. Everybody improves. But if I have to just say substitution, from wheat to rice, and mind you, wheat to rice means I'm having a lower fiber diet. If I'm not changing the quality of rice, if it's white rice, it's the same. And even then, this is what we find. So
and this is very, very important. You cannot substitute gluten with gluten-free foods. Gluten-free foods are just white paste. There's no fiber, there's no nutrients, it's white paste. You cannot substitute regular bread for gluten-free bread. It's okay to have a gluten-free sandwich once in a while. I had one yesterday and I really enjoyed it. It's the first one I've had in a few weeks. You do not eat gluten-free foods every day, meaning cakes and breads and muffins. Oh, it's a gluten-free muffin. It's healthy for me. No, it's not. It's just not poison. And so so do not substitute gluten-free foods for gluten. Substitute rainbow diet for gluten. And you'll head in the right direction, lowering your inflammation.
Yes. And just one more point, which I'd love to discuss, Dr. Wangnu. I mean, Anuradha as a case in point, she's still 92 kgs. She's, her BMI is way above the ideal. And yet, her fatty liver has reversed. And today we see normal BMIs, non-alcoholics having fatty livers for unknown reasons. And actually, it's inflammation. And so this is just, like I said earlier, so much more gratifying and so powerful as a tool, but should not be misused and should not be oversimplified because there are many, many pieces to the diet and lifestyle.
So what I understood, Ishi and Dr. Tom, that as an endocrinologist, to all my diabetics, I should advise them not necessarily to take gluten-free diet, what he is telling, and not necessarily they should replace the gluten with the gluten-free bread or gluten-free anything. It has to be overall balance of the micronutrients and some other non-gluten form of the diet which doesn't trigger the inflammation. So,
Dr. Wangu, if I was there sitting next to you right now, I'd high five you. We would just high five.
So what I've understood that for an endocrinologist like me, should we start advising each and every patient about this dietary concept? And this should be whether a universal recommendation from the various leading organizations about the diet in diabetes?
Who would like to take that question? Tom?
I will take that question.
Yes.
And my answer would be with proper monitoring of their blood sugar, their hemoglobin A1C. Yes, Mrs. Patient, let's start this way for 2 or 3 months. And let's monitor your blood results and let's see what happens to your metabolism. Then, After we see benefit and they're feeling better, their blood sugar is more stable, their need for insulin perhaps is dropping down. If they want to go back and eat wheat again, okay, let's give it a try and let's monitor you and let's see what happens. Body language never lies, never. We just have to learn how to read body properly, how to speak the language. So clean it out of there, stop throwing gasoline on the fire, notice the results in 2 or 3 months, and then go back and challenge again and see what happens.
I think most of the leading organizations like American Diabetic Association, European Association of Study of Diabetes, or the American Endocrine Society, they are always every year, they come with the guidelines about the diet in diabetes, including all of the management strategies. I think why don't the Celiac Society of India, including you, give them a suggestion to include a part in their dietary chapter, diet in diabetes, about the importance of these kind of food. We are talking about the rainbow diet. None of the leading organizations are talking about the rainbow diet as a recommendation. And these are the leading organizations which have a universal consensus guidelines all throughout the world coming from US. Why they are not telling about the diet, what you people are advocating, why they are refraining from this particular kind of diet? What is the reason?
That's a political question.
And this is a
Thank
very
you.
scientific question also, not a political question, because I've traveled the whole world everywhere, how the guidelines are being made and everything. And I think why can't we incorporate all these ideas? And if they object it, if they raise any questions, we should be ready to answer them. I am for that. Now, whatever philosophy is that, whatever diet is that, I think that should be incorporated in the leading guidelines for the management of diabetes related to the diet. We can't talk only on the verbal terms without having any authentication from the leading guidelines.
Thank you.
Yeah, I would just like to add one more aspect of management is testing. So while Dr. Tom has talked about elimination and challenging, I would go further to say that we don't have great markers, but we do have some markers which tell us something about food sensitivity or non-celiac wheat sensitivity in the form of IgG testing. It's called a delayed food intolerance test. So for those who have the ability to do those tests, I would recommend it to them to at least document to them, because otherwise it's challenge and elimination and challenge. And for anybody to really, as an individual patient, this should be a practice, and it's not hard to do because a lot of people are doing it today.
Ishi, I was very glad to know about the anti-inflammatory diet.
Yes.
Because I deliver many lectures about the diet in diabetes, and I've seen most of the textbooks everywhere. That is why this was something new to me today, the anti-inflammatory diet. Because none of the textbooks write about this anti-inflammatory diet, and you told me today, and whether I should incorporate in my lectures and series on the CMEs, diet in diabetes, I should not be bombarded with the questions and the counter claim about the anti-inflammatory diet.
Nobody can challenge that. In fact, there is something called the DII. It's called the Dietary Inflammatory Index of food. That means the food and the inflammatory effect or anti-inflammatory effect related to the health outcomes. And they have been able to correlate this index and prove the correlations with many, many cancers and with several other, and this is a very new research which is happening in this index. So I am tempted to believe that we should now move from calories to the DII. That's where it should be. But these are early days and early conversations. But certainly, these are most gratifying. And I would just say an anti-inflammatory customized diet, which talks about your particular trigger foods, which can be identified. And that is probably the best way I would put it in as a label.
Thank you. So thank you, Ishi ma'am. Thank you, Wangnu sir. Thank you, Dr. Tom. And it's been an exceptionally excellent 1 hour. And I know there are a lot of questions. There are a couple of questions in the audience as well. But I think with these hundreds of attendees who we have right now, I just want to take about 30 seconds and just read out the main points from my notes so that everyone has these 6, 7 take homes, and then we can probably conclude with your permission. So what I have here is that we started with learning that the largest endocrine organ in the human is the gut. So it's extremely essential to give it a lot of attention and take care of it with abundant attention. The second thing that I learned probably was that empower the good guys. So to empower the good guys in the gut, you need to focus on the gut microbiome and to actually empower the gut microbiome so that the good guys can keep doing the good stuff in your gut. You need 2 things that are mainly an anti-inflammatory diet, like what Ishi Costa just explained, and also a rainbow diet, where overall your plate should be half full with about 20 to 25% of the complex carbs, that you have some good proteins and the veggies that are in different colors of the rainbow. Also what I got is that it's not just what you eat, but it's portion control, and it is also the timing or the schedule of your meal that is really important. And again, then Dr. Wangnu sir also took us through the 3 main factors: the genetics, environment, the autoimmunity processes that cause the celiac and the diabetes kind of diagnosis that we get in patients. And actually, the only thing, Dr. Tom, that's going to take up about an hour once I reach home today after the entire day's work is to empty out half my fridge with all that white paste that I have collected there in the form of gluten-free food. So I'm going to get cracking on that. And another take home before we conclude for everyone who logged in, who I'm really, really grateful, is that Dr. Tom said one line, and do mark it in your notes, is that you're not going to learn this in an hour. So do tune into our next webinar that is going to be there in a few weeks' time. And we look forward to learning with you and taking this forward. And over to you, Arjun. And happy to conclude it here from our side. Thank you.
Thank you, Dr. Dang. From one Arjun to the other. Thank you, Dr. Tom, Dr. Wangnu, Ms. Ishi Khosla, and a very big thank you to Ms. Anuradha for coming forward and sharing her true life story with us. As always, on most of the other webinars, I end up doing the moderation as well as the hosting. It's very good to have someone, bright spark of the day, as I call it, Dr. Dang. Great to have you with us on board. And, the mixing of ideas that comes through, that's something we really look forward to. It's a lot of ideas which may not be, as Dr. Wangnu said, they're not written down. They're not part of the official policy. But hey, somebody talked about them. That's when they become official policy somewhere down the line. So if we have a little spark here, and that spark leads to a flame in the future, you all know where it started. On this webinar on wheat-related diseases and diabetes, right? Thank you, everybody. Have a great day and a great weekend ahead. Right. Thank you for your time.
Thank you.
Thank you very much, everyone.
Thank you.
Thank you.